So let's take a moment here to pause and understand again what it means and how to interpret a meta-analysis. So remember, a meta-analysis is only as good as the quality of the primary studies that you're pooling. So let's take an example here. An example here has two treatments, looking at infection rates. If we look at infection rates, one might argue here that it appears as though there are 4 small studies of 50 patients each that all seem to favor treatment B. In fact, one might say, boy, it looks as though these 4 studies favor treatment B. And in fact, if we do a meta-analysis, which is to combine the results of all these treatments, we get what we believe is an overall point estimate, which is the red dot, and we get this measure of precision. And that measure of precision is the confidence interval. What's a 95% confidence interval? You've heard that term used a lot. Basically, it's the interval in which the true estimate of the effect, which is that red dot, lies 95% of the time. In fact, one might think of it as if we were to repeat this study 100 times, that red dot or that result from that study, if we had multiple different people repeat that study, would lie somewhere in that yellow zone. So when we look at that, we say to ourselves, should we combine this data? Does that ultimate pooled estimate in yellow, the 200 patients that we've combined, does it likely represent what we're seeing in the 4 trials? Take a second to think about that. And I put forth to you that if you thought yes, it does, you're probably correct. In fact, there would be very few people who would think that that data is what we call heterogeneous. But now let's change it up a little bit. Let's look at this particular permutation. Now we've got some studies that say favors treatment B. We've got some studies now that kind of look like there's no difference. But overall, when we combine the results of these studies, it still appears as though treatment B is favored. Ask yourself this now. How many of you would feel comfortable in assuming that that overall yellow pooled estimate of effect in the meta-analysis here represents the truth or represents what you think really is the treatment effect between A and B? Now, some of you may also have said yes, and I would say, in my opinion, I think this is something else that I would probably agree with. I would say there's not enough heterogeneity here that would argue that we shouldn't combine this. But now let's go to a different example. Let's just say now we have a situation like this. The overall estimate of effect says there's no difference. But in fact, there's 2 studies that say we strongly believe treatment B is better, and there's 2 studies that suggest, in fact, that treatment A is better. Do you think at this point, the pooled estimate saying there's actually no difference between treatment A or B makes sense? And I suspect those of you who are scratching your head thinking, I'm not sure, you're absolutely right. You should not be sure. And in fact, this is the classic situation in which we would define as heterogeneity, which is a difference in the apparent treatment effect across studies. So in other words, it's a nonsensical to state that there is no difference when we clearly see there's some subgroup of studies, could be the patients, could be the interventions, could be the outcomes that were used in those studies, that clearly suggest treatment B is better, and there's a subgroup that suggests treatment A is better. So what do you do in this situation? In this situation, you would not pool, and you would explore why we have heterogeneity. So when you look at a meta-analysis and you see that they have reported heterogeneity, you can look at this value called the I-squared. If it's not 0 and it's higher in the 40s, 50s, 60s, and sometimes 70s and 80s, you should immediately be asking yourself, did they explore for possible causes of why these things are different? And you look for those tables and those figures as what we might consider subgroups, but they're looking for why are these studies different? And they thought about it before they actually did the analysis. So what causes it, right? Well, there's all kinds of things that can cause it. It can be the differences in the populations, differences in the interventions that were used, could be differences in the outcomes, and ultimately the overall design of the study. Some are better quality trials, some are not so good quality trials, and those all those sorts of things would make that difference.